Hey everyone, today's topic is hypoglycemia. So, in a hypoglycemic patient, what findings we will see? There will be weakness, pale and moist skin, shallow respiration, headache, and altered level of consciousness. Okay, then management. In management, we will first see the state of the patient, whether he is conscious or unconscious. So, there will be different modes of treatment for that. In unconscious patient, there will be first we have to recognize the hypoglycemic state, whether the patient is alcoholic or whether that is genuine hypoglycemia. Okay, so we will ask the patient party or the patient that what was the last meal and when was the last meal and whether he or she has taken the insulin dose, last insulin dose. Okay, then immediately terminate the procedure. And now come in patient position as the patient is conscious, so we will position the patient according to the comfort of the patient, so mostly upright. Now we will give BLS if it is required. If not required, we will leave the step. Then oral carbohydrate administration is the most important step. So what are the forms of oral carbohydrate we can give? There is sugar. Sugar is always present in the emergency kit that is present in every clinic. It's a must to keep a emergency kit that has adrenaline, sugar, and some things like that. So sugar, if sugar is not present, juice, some form of juice, and candy bars. These things we can give as oral carbohydrate. Okay, then we will permit the patient to recover, and for that we will give minimum 1 hour observation to the patient. Then if the patient does not recover after 1 hour, we will call for the medical assistance. Okay, in medical assistance, what the medical person will do, they will administer glucose in the form of IV or IM. IV means intravenous or intramuscular route. Intravenously, there is two forms. One is glucagon. Intravenous is 50% dextrose, that is given within 5 minutes. There will be response. Okay, and glucagon 1 mg given 2 to 3 minutes intramuscular, so response will be within 10 to 15 minutes. 50% dextrose gives a rapid response and glucagon 1 mg gives a slower response. Then there is another form, that is transmucosal. Transmucosal, when we will opt if parenteral is not available or if patient is not willing to take parenteral, then we will go to transmucosal. In transmucosal, small amount of honey or syrup or decorative icing is given in the buccal fold. And what one thing we have to keep in mind during giving transmucosal is that the patient should not aspirate it. Okay, because it has high chances of aspiration, especially in an unconscious patient. As it is a conscious patient, the chances are less, but still we have to keep in mind. Okay, then we have to monitor the patients, check vital signs every 5 minutes until medical assistance is available. Now in case of unconscious patient, first foremost thing is terminate the procedure. Then patient position is supine position with the legs elevated slightly. Then if BLS is indicated, BLS is basic life support system. If BLS is indicated, we will give or we will skip the step. And in BLS, mostly the airway is managed because breathing and circulation are almost normal in a hypoglycemic patient, so only airway is seen. Then medical assistance if BLS fails to respond. After giving BLS, if patient is not responding, then we will have to call medical assistance. Now definitive management is same as that of conscious patient, that is parenteral administration of glucose and transmucosal administration, same steps. Then recovery and discharge. So every 5 minutes we have to check the vitals. Recovery, now in case of unconscious patient, the recovery happens after the blood glucose levels is elevated. after the patient recovers, the patient gains consciousness, we have to administer him oral carbohydrates in the form of drinks or candies or anything like that. Okay. Now, what happens in cases of unconscious severe hypoglycemic patients is that there is also associated seizure episodes with that if the patient is a seizure attack patient. So in that case, we have to also follow the guidelines of seizure disorders. Now, coming to the conclusion of the management is that in cases of diabetic patients, always postpone the treatment until diabetes is under control. Second is give early morning appointment. Always give early morning appointment in cases of diabetic patients. We have to follow stress reduction protocol, and if the patient is allowed to take normal diet after surgery, ask the patient and advise the patient to take normal diet along with normal dose of insulin. And if the patient is not allowed, then he or she should halve the dose of insulin she takes usually. Okay, that's all. Thank you.